last name and discipline in the chat box for attendance. We also are no longer going to accept people for CMEs after quarter past the hour. So make sure you get in, sign in on the link and into the chat box. If you have any chat box questions, Maria, are you happen to be logged in?
Yeah.
Do you mind doing that today?
Yeah.
I feel like the chat box is just where it's going to be at because the Padlet didn't get used. So maybe we'll revisit that next week and see how people think. But for right now, we'll just go with chat box, and Maria is our chat box champion. We'll share out anything that comes through. Today, I'm really excited that we have Doctors Pam Williams-Aria and Nicoletta Frankenstein sharing out on what we call prenatal development number 1, really about prenatal and infant brain development and environmental exposures and toxins. And of course, as you've heard me say many times before, both of these lovely women were LEN trainees here at Cincinnati Children's. So yeah, they have a lot of great information. It's dense, so we'll probably offer a break halfway through. And yeah, feel free to ask questions and have a great session. Okay.
Thanks, Steph. Yep, I'm Pam Williams-Aria, and Dr. Frankenstein and I are going to tag team this afternoon. And as Steph said, this is kind of dense material for some disciplines. This may be a lot of new stuff, maybe entirely new stuff. And for some people, this is going to be very basic and, you know, stuff that maybe is even kind of a lower intensity than what you knew for other courses. And it's all good. By no means do we expect you to learn any terms or memorize any pathways or anything. The whole intention is to get a good overview of infant and prenatal infant brain development and exposures. Maybe.
Just make sure the cursor's over on this screen, Pam, and it should let you forward.
Okay. This was working a minute ago. Ah, there we go. So our overall learning objectives are, again, to talk about just the overall structure of the brain, how that relates to function and vulnerability of the brain during certain periods of development to toxicants and other exposures. So the very first part is going to be focused on just basic development of the brain, an overview of that structure and function, and just some basic overview of how environmental factors can affect that. And then we'll get into more detail in later parts of the session. So as everybody knows, you know, the brain is hugely complex, billions of cells, at least 100 billion, and different brain cells based on their location, how they specialize, always affects neurologic function. Any disruption can create some permanent difficulties for an individual, and many things that may not get diagnosed until much later in childhood or even adulthood can be tied back to fetal brain development. So just a few basic things. The brain is the center of the nervous system, and at a very basic level, you can think about it as taking in information from the environment. That's our sensory system, you know, doing something with that information, that being the motor system, and then retaining the result for future reference, and that's memory. And classically, the brain is comprised of 4 lobes, with the frontal lobe. Try to use this, get the mouse over here. So the frontal lobe here, classically involved in emotional control, reason, executive functioning like planning, organizing, attention. The parietal lobe, classically with sensory processing, occipital with vision, and temporal with auditory. Other parts I wanted to point out, just the cortex is the surface here of the brain. The cerebellum classically around balance. Basal ganglia, some motor control, also involved in some emotion and behavior. A brainstem is just basic respiratory and cardiac regulation. And then the spinal cord here. But the brain is protected by a thick bone called the skull or cranium. And it's suspended in fluid called cerebrospinal fluid that is flows around the outside of the brain, all the way down around the spinal column, and then up through the ventricles here, and it flows around. The brain only weighs is only 2% of your body weight is the brain. However, it takes 20 to 25% of our calories, our oxygen, and our glucose. So it utilizes a lot of our resources. The size of the brain determines the size of the skull. So the skull only grows because the brain is enlarging and expanding. And the body will try to preserve the brain. So all those calories it needs, like if someone in our audience, eats 2,000 calories a day, about 500 of those are your brain's going to use, believe it or not, which is a lot. So if someone like a child is in a calorie deprived environment, like in a period of famine, somewhere like Yemen or somewhere where a lot of kids are in a state of famine, the first thing you'll see decline is weight. And then the next thing that's affected is height or growth. They're not going to lose height, but their trajectory of height will be compromised. And then lastly, you may see a smaller size head. So that is the last thing, because the body's always trying to preserve calories for the brain. It prioritizes the brain. So just a quick overview. We always have to go back to pregnancy, because that's where fetal development starts. So this is just a quick overview of that. Me.
The product of millions of years of evolution, the human body is capable of many remarkable things, but none of which may be quite so incredible as the development of life in utero. Over 3 million babies are born each year in the United States alone. Worldwide, the highest fertility rate is found in Niger, where the average woman gives birth to approximately 6.49 children in her lifetime. Singapore sits on the opposite end of the spectrum at just 0.83, less than 1 birth per woman. While the number of births, customs, and traditions vary from culture to culture, the developmental process is essentially universal. Derived from the Latin word pregnantem, meaning before birth, pregnancy is the period in which the fetus develops inside the womb. Typically lasting around 40 weeks, human pregnancies are divided into 3 trimesters of 3 months each. Pregnancy begins in the uterus, where a sperm fertilizes an egg. If the sperm carries an X chromosome, the baby will become female, while a Y chromosome will result in the baby becoming male. The fertilized egg, or zygote, divides repeatedly as it travels through the fallopian tube, implanting itself on the uterine wall to form both the embryo and a specialized organ known as the placenta. Found only in eutherian or placental mammals, the placenta will manage waste and provide key nutrients, oxygen, and hormones via the umbilical cord. The brain, which will continue to grow and develop throughout the pregnancy, makes up nearly half of the embryo in these early stages. As the eyes, nose, ears, and mouth, along with all major organs, continue to develop in month 3, the baby will begin to look more and more human with each passing day. The second trimester lasts from weeks 13 through 27. The fetus will more than double in size during this time, and soon its movements may be felt by the mother. Hearing first develops around week 18, but the fetus will not respond to sounds outside of the womb until approximately week 25. Starting at week 28 and lasting up until delivery, the third trimester is a time for final touches such as eyelashes and taste buds. With most major development complete, the fetus will gain nearly half a pound a week. To make room for this rapid growth, the mother's internal organs adjust significantly throughout the pregnancy. Dropping lower into the pelvis, a fetus typically turns heads down in preparation for birth. Most bones will have hardened by this time, though the skull will remain relatively soft to ease the delivery process. Labor is divided into stages, beginning with the dilation of the cervix and resulting in the delivery of both the baby and the placenta. Despite thousands of years of human pregnancies, scientific understanding has only recently begun to catch up, leading to an increase in success and safety for both mother and child. As our understanding of pregnancy continues to develop, so do technology and reproductive medicine, with much more in store for the future of pregnancy.
Okay, so as the video said, pregnancy classically into 3 different trimesters. But I think it's really important to remember that a lot of women don't know they're pregnant until well into the first trimester, particularly as a lot of women may not have regular menstrual cycles, which is how typically how most people would recognize that they're pregnant, or if they're having, not everyone has morning sickness. If they do, it may be mild or they attribute it to something else. So it's important to think about. And then the other thing I want to point out is just how many pregnancies are unintentional. So people aren't on the lookout for it. So just throw out a number. What percent of pregnancies do you think are unintentional in the United States? Just somebody throw out a number.
30.
It's actually estimated to 50%, up to 50% are unintentional. So I think when we start to talk about exposures to alcohol and other substances, it's important to remember that a lot of people aren't aware that they're pregnant until they're well into their pregnancy. We're going to talk about this. You're going to see this multiple different times during this talk. And those of you in ITT case 1 saw a similar picture that Brad put up the other day. But basically, this chart shows horizontally the developing fetus. Vertically, there are the number of weeks in the gestation. And then I want to point out just horizontally, the blue and green bar here horizontally on the chart, which shows major organ systems, and the blue represents when major structural problems can occur if there is some kind of issue there, versus the green is more minor malformations. And then when it becomes white, like basically everything is complete and there wouldn't be an effect. And we'll talk about that a little bit more. So again, the video showed this, but typically this cross section of the uterus, the fallopian tube, and the ovary, and typically fertilization occurs in the fallopian tube, and then up to a week later we'll get down to where it's going to implant, and then a few days more to implant, and the circulatory system attached to the mother's blood system through the placenta. So the first couple of vertical rows here is just the zygote, and how it's probably relatively immune to exposures at that point, because it's not yet, attached to the mother's blood system. But the rest of it, obviously would be. This is just a different way of looking at that fetal brain as it develops, over the course of those weeks and months, and how it's evolving to look more like an adult brain there towards the full term. So we're going to talk about 4 different phases of the brain development, and the first is the neurons developing, and so this is just the initial formation. The second is the multiplying. The second, a neuron just means brain cell. That's all that means. And then the brain cells migrating, moving out to where they're supposed to belong. And then lastly, becoming insulated with a fatty substance called myelin. And we'll talk more about that too. This is just superimposing the picture of kind of that brain developing over top of the 3 trimesters. And then what those phases that I just spoke of. So the first trimester you can see is really those brain cells developing and multiplying. The second trimester is really lots of multiplication and brain cells migrating out to where they're supposed to be. And then the last trimester, there's some planned cell death, so that pruning or apoptosis, reorganizing, and then myelination happening. All right, I'm going to turn it over to Dr. Frankenstein.
Thank you. So as we said, the first part here is just those development of those brain cells. So the neurulation, if you look from here, you have this initial fetal brain. It slowly develops a cleft and then kind of folds over upon itself. And you have this midline groove. And so that's where it then creates kind of the rest of the brain, the spinal cord, and everything that you saw in those previous images. So when this doesn't go as planned, you get neural tube defects. So these are just some of the multiple neural tube defects that can happen. And then there's another one commonly seen, I guess, or at least in our population, and that would be spina bifida. And so with this one, you have that folding over. So like you saw on the prior two slides, and then around 22 days is when you have the primary neurulation. And so if something goes wrong between days, say 22 to 26, that's when you can have an open case of spina bifida where there's no skin, nothing overlying it. And you would have what's called an open defect. And we'll have some pictures on the next slide too. And then if it happens 26 days or later, that's when you have the closed. And so you can see, you're thinking, how early is this in pregnancy? A lot of women have no clue that they're even pregnant, what's going on. And a lot of this is already done. So with this, that's why it's recommended that people who are thinking that they may want to get pregnant, that they take folate and take the prenatal vitamins ahead of time, because that's one of the things that can help prevent. A folate deficiency is one of the causes of spina bifida. So within here, you can kind of see that normal anatomy and how things would look in a average kid. And then within the spina bifida, you'll have different kinds of defects, is they're called, depending on when it occurred, how it happened. And then because of the defects down here in the lower back, you're also gonna then have changes up in the brain as well. And then down here in these pictures, you can see some kids, all you see is a small tuft of hair. So you would have no clue, there just might be a little tiny dimple there or a small tuft of hair, and that's the only indication that you have that there's an underlying defect underneath it, then compared to the kids that had it done earlier in that pregnancy. So as I already said, kind of failure of the neural tube to close properly, it is one of many types of neural tube defects. And then a lot of times the neurologic impairment and then the secondary sequela of the spina bifida is all dependent on where it is, how severe the defect is. And so it can be motor, it can be neurologic. And then you also do have some academic at times that you can see with some of these kids. You can have seizures, you can have orthopedic problems, bowel bladder, incontinence, or they may have partial continence, some have to cath, some don't. So it's a very wide spectrum with everything. As I kind of mentioned with the folic acid and the prenatal vitamins, there's multiple different risks that can lead to a child having spina bifida or having a neural tube defects. Folic acid is one of the main ones that we are aware of. There's other medications. I don't know if anybody knows any other medications they may have heard of, and it's okay if you haven't. And then diabetes. So especially if there's maternal diabetes, that can be increased risk from there. And do you got people know overall, is it more common in boys or girls? Girls. Mm-hmm. More common in girls. So, should we shoot a video or should we questions?
For the reference to diabetes, is it
Get the microphone, sorry, Anna.
in reference to the diabetes, is it gestational diabetes or like preceding diabetes? Like they had type 1 or type 2 before they got pregnant?
I believe it can be both. It's more so if you have the preceding and the control of the diabetes from that. But I believe it can be linked in gestational, but a lot of times gestational is diagnosed later. And I don't know, but I know it's been in just, they've had it in gestational ones where mom wasn't diagnosed with gestational diabetes per se earlier and diagnosed later, but generally pre-existing. Good question. Should we skip this video even or do this one?
We're trying to incorporate some
Real life
real life
examples for you
examples.
guys.
And this is not an advertisement for Johns Hopkins. You like this story.
Harper is our little girl. She is 2.
Like the CC.
Where's it at?
At the bottom, near the YouTube.
1.5 years old. She
This
was
is embedded. I don't know if I.
Oh, okay.
born with
Do it
spina
that way.
bifida. She's very, very outgoing. She's a boss.
She's just this little, sweet, spunky little girl. Harper has spina bifida. It's at the thoracic level. Being how high it is up in her thoracic spine, you know, typically kids with that diagnosis don't sit, they don't crawl, they don't stand, they don't walk. You know, without those muscles, it's not as easy as it looks. I had to get her comfortable with me, and we built some connections, and we became friends quickly.
I love you.
We worked at a bench for many months, you know, sitting on the edge of the bench, building up her confidence to just get into standing. And eventually, you know, we got her taking those first steps.
1, 2.
It was baby steps at first and a few steps here and there. They were not pretty steps.
Good step.
They were very sloppy, but they were the most beautiful steps I've ever seen.
Hey, are you ready to sing Baby Shark? Mommy Shark. Harper's really come out of her shell in the last few months. Daddy Shark. Daddy Shark. We did that. You know, it wasn't just me. It was Harper and her family. Good job.
The care that we have received from the outpatient rehab center has been far and above what I came in looking for. From having a comprehensive team of a developmental pediatrician to having an occupational therapist and a physical therapist that all work together to formulate a plan of care, it's amazing. She shouldn't be able to have the ability to do what she does, but she does. I think she's going to change the world personally. She's definitely going to do great things.
I was going to say, thank you for commenting on the closed captions. If anybody knows how to do closed captions on an embed video, I think you should be able to get them on there even when it's embedded. Just trying to figure it out for the future. So that way we can go. More recently, and I put this slide in now, there is prenatal intervention of spina bifida. And I don't know how many people have had exposure to this or kind of awareness overall, but we're having centers at fetal care centers that are actually able to go and do surgery on the fetus, on the baby between 22 and just under 26 weeks and actually fix that defect, fix the spina bifida. And then mom is kept on complete bed rest for the remainder of the pregnancy. Because if you think about it, she pretty much has the equivalent of 2 C-sections. She'd have that surgery to fix everything and then the C-section at time of delivery for this baby as well. This is very helpful, especially for those babies that have the open defects and anything where it's exposed to the amniotic fluid, where it's exposed to the fluid around the baby. More time exposed to that fluid can be more detrimental. And that's where you see loss of kind of those motor skills and everything else. And it's found that by doing this surgery, for those that are eligible for it and are able to access it, it can show improved outcomes down the road as well. And then, again, you kind of see here with the fetal brain development. So you have this neural tube, which is what we've been talking about most of this time with the spina bifida, with those defects. And then it ends up starting to curl in on itself to make that forebrain, midbrain, hindbrain, spinal cord. And then that's where you kind of get that continued growth that you saw in those previous slides as well. What you can see for some of these is that you can have, if it doesn't match up properly, there. I was like, there it is. Down here where you can have other brain changes as well. So while the outside may or may not look normal per se, those inner structures may not be exactly how they're supposed to be, which then again can lead to underlying difficulties in various fields of development.
Okay, so the next phase in the development of the brain is the proliferation. So this is just the multiplication, the rapid growth that occurs in the fetal brain. And it's growing most rapidly during the kind of second half of the first trimester and into the second trimester. And this is also when there's specialization of the brain cells and the chemical messengers, which are neurotransmitters. And there's a lot of growth around the area where the spinal cord comes through the ventricles. And this is a very vulnerable area that we'll talk about again in a little bit when we talk about preemies. But a result, if there's a disruption here, because this is when the brain is growing, you can get a smaller head or microcephaly as a result. And I don't know if you can see the mouse, but basically like the cortex of the brain here, where you see all these grooves, these sulci, they're called, where they fold in on each other. The gray part here are the cell bodies. That's the gray matter. And then the white part, which is the interior, are the axons, they're called. And that's the white part of the neuron. And then this here is the ventricle. And so the periventricular areas are the area just adjacent to that. So Zika is a virus that's transmitted by mosquitoes, and there was a huge outbreak from like 2015 to 2017 that you might remember, mostly in South America, but also the Caribbean, and there were even some cases in the US. But a lot of it was in Brazil. And fortunately, there's no outbreak right now. The CDC has a website page on this, and as well as all kinds of other things, obviously. But you can look up a map, and I just checked it yesterday, and there's no current outbreak, but they still recommend caution if you're pregnant traveling to areas where it's still around. Zika is still there. It's just not a big outbreak right now. So Zika is, again, transmitted by mosquito bites. It can be actually, what people don't often understand is that it can be transmitted pre or post conception. So this is can be a sexually transmitted disease because it can survive in semen for up to 6 months. So something to know. And most cases are asymptomatic. If someone does have symptoms, they're typically kind of those flu-like symptoms. Incubation period is long, can be 45 days. But there can be a wide range of abnormalities depending on when the mother is infected, and the first trimester being the most severe. So just some pictures here of what microcephaly looks like. This is a typical size head, and then you can clearly see here how much smaller this other head size is. And then this child here, you can clearly see like just the size of the head with relative to the rest of the body here. And these MRI scans, this is just a typical brain. The middle one is a child with primary microcephaly, and we actually had that can be a familial, and we actually had a LEND case a couple of years ago where it was primary microcephaly was one of the diagnoses, and that's just something that can be genetic. And the lower slide there is just somebody with severe Zika, and so you can see how affected that brain was. I think I'll just skip this video just for the sake of time here. Oh yeah, sorry, go ahead.
What's the life expectancy for babies born with microcephaly? And
microcephaly? I mean, you could have a normal lifespan if it's just microcephaly. Like the familial microcephaly, actually, you can have a completely normal life. It's just like a kind of like a random, very small head size compared to, others. But with Zika, I mean, I don't think we really know, because a lot of those kids are only a few years old, maybe 5, 6 years old right now. So as far as like their long-term outcome, I think that's still being studied. It's a good question. The next phase is cells moving out to where they belong within the brain, and Dr. Frankenstein, take over.
And so again, kind of looking at the brains, reminding yourself the overall picture, trying to always bring you back to here. And so within the migration of itself, and as kind of discussed in that last picture, you have these cells that start moving outward to that outside of the brain. So you get the gray and the white in the difference from there. And that usually is between 12 and 20 weeks. So really during that second trimester of pregnancy. If that is disrupted in any way, it can lead to these disorders. Big, long, fancy scientific names. I'll show you a picture of the different ones on the next slide. I know you guys don't need to correlate with each of them. But again, these symptoms can vary significantly just based on the individual, based on how they're responding. And even two individuals with the same underlying disruption and kind of similar brain patterns can have different motor aspects, may or may not have seizures, developmental delays, microcephaly. And so this is where a lot of you come in as well with the supports, because it's one of those, each kid is going to need a different team and members of their team to help out. So these are just the different pictures that you guys can see of those big fancy names that we had before. So if you look here for A is actually what a normal brain generally looks like. So if you're thinking you have your average person, that's what their brain would look like. Some of these different migrational disorders you can see here, you have different amounts of kind of the gray and the white area, different amounts of those sulci of how it's going in. So some of times they're smoother like this, and then there can be different sizes within the ventricles themselves. And is it actually still two separate ventricles, no ventricle at all, large ventricle? So again, how this is going to affect the kid depends on what areas of the brain are affected by these changes and by that movement. And then going over to the last portion for the development.
So the last part is of the brain development really is the myelination. And so this is a neuron, this is a brain cell. And I read in a neurology text how they likened this to a tree, and I kind of like that, so I'm going to use it. So the big part here to think about is like the root system of the brain cell, and this is the sort of the cell body, and this part is the axon, the trunk, if you will. And then this part out here is kind of the axon terminal part of the axon, and it's kind of like the tree little branches or fronds here at the end. But this whole axon part is really important. The cell body can receive messages from other cells, and then this axon here gets wrapped in a fatty lipid substance that helps to insulate it and makes conduction of the message electrical and faster. If you think about like wrapping electrical wire and insulation, it's kind of the same thought, same process. And then when it gets out here to the terminal part of the axon, it's basically where those little chemical messengers get released. And so in the neurology analogies are about like pollen getting released. But anyway, just one way to look at it, but that is like what one cell body looks like. So the myelination, where it's getting wrapped in those kind of fatty substance, starts in the spinal cord and brainstem, then moves up. And it doesn't get completed until a child is about 2 years old. So a baby is not born fully myelinated. And before it's myelinated, the brain is more susceptible to things like infection and hypoxia. So that's important to remember. And injury here can be associated with cerebral palsy in some cases, if there's been a hypoxic insult or infection or other reasons. But this just shows, if you look over here at a newborn, and then if you look by the time they're 2 years old, how much different that looks as far as the amount of white there. And then here you kind of see, again, there's a lot of blue in the 2-week-old, and then with age, how that looks different. And that just shows the myelination occurring. And again, this cross section just showing that periventricular region that I mentioned earlier is most susceptible to lack of oxygen or decrease in oxygen is right here. And on an MRI, you can see compared to a normal MRI that this is a lot more white here, and we call that periventricular leukomalacia. And if those of you on ITT team 1, this is kind of what we were talking about, what Brad was talking about with the patient having periventricular leukomalacia. So that's just kind of what that looks like on MRI. This is an old March of Dimes poster that I like, bigger is better. So the bigger brain is just more protected, and the preemie brain is a lot more susceptible. I think we can do this. Don't know how to do the closed caption when it's embedded. I apologize.
I wonder if maybe since your mouse is hovering over this,
If I can,
you click play, there's like that bar that pops up at the
is
bottom.
it going to pop up?
Like, you just
Aha.
click right there. Yeah, there were.
Thank you, Brad.
Yeah.
You do? Why do you like her?
Because she has to act.
I had a bit of a hard pregnancy and a challenging birth. And when Journey was born, doctors told me that given the injury that she had sustained, that there was a strong likelihood that she wasn't going to be able to see, talk, or walk. That was a really hard pill to swallow as a mom.
Journey presented to us spastic cerebral palsy, and our evaluation of her revealed multiple contractures. She was also having a significant amount of tone and spasticity. We wanted to tackle this, but noted that the contractures were getting in her way, and so we decided to proceed with surgery to release the muscles, lengthen them, and relieve the contractures prior to planning for spasticity management.
So Journey had rehab after both her orthopedic surgery with Dr. Vargas and then after the selective dorsal rhizotomy. So with the selective dorsal rhizotomy, we're rather rapidly, at the time of surgery, changing the muscle tone in her lower extremities, in her legs. And because of that, she has to learn to re-walk and learn how to use her legs again and how to walk with a nice gait pattern as opposed to a typical 4-year-old pattern of getting there as fast as possible.
1, 2, 3, go!
All right.
I think with this whole journey, what I've seen in Journey the most is her light and how these surgeries and these experiences with the doctors and Kennedy Krieger Institute have added to who she is and her self-esteem. A couple of things that I've noticed is Journey's ability to stand independently. We're in the beginning of the process, but just seeing her be able to stand for 20 seconds and have that level of freedom is something that I was told would never happen.
Well, we're very fortunate at Johns Hopkins in that we have the opportunity to work with a really world-class place like Kennedy Krieger Institute, where they're very well known for their rehab. They have excellent programs here that are not necessarily found elsewhere, and because of that, the kids can take advantage of all the expertise.
Journey is a very, she's a tough girl. That's the way I would put it. In spite of all the spasticity she had, when her mom asked her to walk, she just put in everything she had into it. And to see that in a child who's 4 years old, just sees the determination that she had.
I believe all parents want for their kids, for them to be an amazing human being. And I definitely think that Johns Hopkins and Kennedy Krieger have added to who she is as a person in a way I never imagined. Journey, do you like your doctor?
So again, this is not an advertisement for Johns Hopkins. It's a wonderful institution. We have great programs here too. But the personal, and I looked for the videos. I think there are some of their personal stories I just thought were really outstanding. So that's why I picked those. I think we can still get, do you want to stop now for a break or do you think keep going?
I say let's go.
Yeah.
Can stop.
Okay. Perfect. So we're going to start the next part by talking about, well, first, any questions about the first part? Any other questions? I'm not really monitoring the chat. Hopefully somebody else is. Okay. Yeah. Go ahead.
So obviously with the advancement of medicine, we have the ability to save a lot of natal babies way farther in advance than we were in the past. And for babies that are born premature, we kind of use the age of 2 as like their catch-up period. We have like the adjusted age for developmental milestones and things. But is there like a specific week or time frame where we see that a baby will not catch up like outside of the womb for that development?
Well, the viability hasn't really changed very much in the last few decades. I mean, it's still kind of like 23-ish weeks, something like that. But as far as like, is there a week of gestation where we would say there's absolutely no way that they would have normal life? No, I mean, I think there's always like, well, there might be a much greater risk. You know, the younger they are and the smaller they are, nothing's 100% where they would, I don't know if Brad or Nicoletta disagree with that.
That I use as the example
Yeah.
of exactly that is I have a kiddo who had been a twin. Mom lost the twin at 12 weeks. He was born at 23 weeks and he weighed 400 grams. He fit into the palm of my hand. And I mean, he had a long road in the NICU and everything else. And you look at him now and yes, you can tell there's differences because it turned out he actually had a form of dwarfism as well. complicating that whole NICU course where we're like, are you just not growing because we're not doing the right things? And, but he's functioning great, considering that, where when they handed me a baby that fit in the palm of my hands, I'm like, how are you ever going to walk, talk, go? And I ran into him at a amusement park, because this was before I moved here. And it was one of those, like, he was running around like the rest of the kids. So he's my example of, you really have no clue.
Yeah.
When you're handed that, how things really are gonna be 2, 3, 10 years plus down the road.
And I have some similar anecdotes too. So I still think, the odds can be difficult the more premature you are and the more complications you have in your course in the NICU, for example. But, there's always these kids that, it just astound us. So.
Because the other thing is you can have term kids that were born at term and then had an oxygen issue.
Yeah.
And developed cerebral palsy and have those too.
Yeah.
So it's.
Right.
Nothing's ever given.
So objectives for this next section are to talk about different substances and toxicants that can affect the child's brain and, how those can be associated with specific issues. So windows of vulnerability can be preconception, like we just talked about Zika, or other like exposures that can affect like basically the sperm or the egg themselves, in utero exposures or disruptions. And then again, like we said, those first couple of years are very vulnerable too for kids. So, and the issues or disruptions can be from chemicals, metals, industrial type of things, drugs, alcohol, medications that are prescribed, pollution, radiation, and infections. So really, obviously, classic example of this is thalidomide, which was widely distributed in Europe in the 1950s, mostly like from 1957 up until 1962, specifically for nausea and vomiting, morning sickness in pregnancy, and 10,000 babies were born over that time period with severe limb abnormalities as a result of the thalidomide. This person with JFK is Frances Kelsey, and she was the FDA reviewer who rejected the application of thalidomide in the United States because she was concerned about the safety. So it never was marketed here or distributed in the US. Quicks, and so here she is being honored in 1962 by President Kennedy. But interesting sidebar about her is that when she applied for the job of being an FDA reviewer, she was accepted on the merit of her application. But when she arrived, they were disappointed that she was a woman because they thought Frances, was a man's name too, and that she wouldn't have been hired. And I was reading about her if they had known. So that's an interesting sidebar in the 1950s. So we're back to this chart again, and researchers could really pinpoint within almost a day for some kids of when their mom may have taken a dose of thalidomide, for some that just took a dose or two, based on which abnormalities, because you can see the upper limbs here, the lower limbs here. And so it was very particular to when the mother took doses of thalidomide. However, for people that took it after the limbs were developed here, because you can see this at about 8 weeks, or everything is formed. And then there was no detrimental result if it wasn't taken in those, first 8 weeks. So it just shows the vulnerability of those windows. But I want to point out the upper bar here of the central nervous system, and that goes all the way across, because the central nervous system developing has vulnerability throughout the whole gestation versus some of these other body systems. Other examples, rubella, if it has severe ear and eye abnormalities, if the mom is infected during the first trimester. However, if a mom is, and there's more minor ones between 12 and 20 weeks, but if a woman is infected in the third trimester, generally there's no repercussions. So again, just other examples. Accutane is another example, if we want to keep looking at this chart for a second, where it can cause most severe damage in the first trimester, but very severe abnormalities can occur with taking Accutane, which is used. It's a medication for severe acne. It's usually reserved for very severe scarring type of acne. But obviously that usually occurs during the teenage years. And, girls want to be able to have access to this too. But because of the severity of the birth defects, it's required that you have 2 negative pregnancy tests before it will even be prescribed. And then with each prescription, each monthly prescription, you have to have a negative pregnancy test, just because of how severe that can affect the fetus. Oh, sorry.
So with Accutane, like while you're taking it, I know it can like cause like birth defects. Is there any research that like if they took it as a teen, they're still going to be affecting fetuses, or is it just while you're pregnant?
Just while you're pregnant.
I'm just out of curiosity, if the person who wants to take Accutane is a woman, but then they aren't having any sexual activity with male partners, would the pregnancy test still be required or not?
Yes.
It's one of those where too many people have said, I am doing whatever, and going by that word, you as a medical provider that could be liable for not confirming with the test.
Yeah, good question.
Unfortunately,
Yeah.
in today's.
Yeah. So the other thing that's forming during this time period are those brain cells that we talked about, the cell body being over here, if you can. And it's hard to see, but this is the cell body. This is the axon over here of another brain cell. And then these chemical messengers here are used to communicate between brain cells. And there's this little gap in between called the synapse. And the little messengers go across and then they're picked up here in the receptors. And so this is something that's forming rapidly during this mostly second trimester, but throughout gestation, but during this phase, and can have big effects on kind of behavior and brain function if there's disruptions during this time period. So I think this is where we can probably,
This slide,
yeah.
and we'll stop. and
Yeah.
break after this.
We're at probably a good stopping point right after this slide, so people can take a bio break. But these pathways, of the chemical messengers, one pathway is serotonin, and that is a pathway that's highly involved in sleep and mood. And then dopamine as well, highly involved in the reward system. So if you think about like addiction and things like that, dependence, that you get this reward pathway that is affected and kind of reinforced. So it's also involved in mood and behavior. Both of these are like highly involved in some of the medications that we use to treat anxiety and depression and other things. But these are the pathways that can be affected when there's disruption during this part of brain development. And so this is a great stopping point before we get into this, dig into these a little bit deeper. So let's take a 5-minute break.
Yeah. Downstairs. So sweet. It's not like, okay, I wouldn't want to go. I'm like, oh. No, I want to. Okay. No, you're not. Thanks to weather. Are your fans Snoopy? Yes, they are. They're really. I used to have a baby Snoopy. Yeah. So Tom's came out with like two lines of Snoopy shoes. I bought 4 pairs. I just thought. Are your socks also Snoopy? They are. No, I just got an email that t-shirt line junk food. You ever look at junk food? No. Literally called junk food. I mean, I need to stay away from stuff. Okay, well, but every now and then it's my kids like them, and they just did a collaboration with Snoopy, and they've got like Snoopy NFL. Oh my gosh! And if you're into Snoopy, but you must be making like a big comeback here. Is it called junk food? Junk food clothing. So t-shirts, they're super soft. They're like vintage style t-shirts, but they just did a Snoopy collab, and I'm pretty sure they have. I did like a Marvel. They did a Marvel collab with NFL players that I got last year for my guy. Yeah, that's I was trying to think, I'm trying to evaluate it. No, and it's. Where do you work?
I'm mostly here. I've also been at State and Anderson's and Basic. They kind of throw me
Really?
around.
So you're with my. Okay, sure. Annabelle? Yeah. Middle name too. Yeah, you should middle name too. Catherine. Yeah. I think so.
Name sounds cute.
Oh, she's so cute. But no, and I know you go through so many people every day with everything else, but. You had her follow up and then they were like, wait, you have to do audiology too.
Yeah.
And so that's.
It's definitely possible. Yeah, I usually remember better if I'm in there with them, but yeah,
It's all good. And I'm like, and I could be wrong, but it's one of the, or maybe you're just not either.
yeah,
Because.
yeah.
Like,
Yeah,
I'm
I'm definitely usually around here if it was on
Oh, yeah,
the Monday, Tuesday, or Thursday.
yeah.
Usually.
I don't even remember what day, but I think it's on Tuesday. It would have been a Monday or Tuesday.
Oh, yeah, yeah.
I don't think it's been on Thursday.
Might have been.
My kids are all now seeing way too many stuff. My son, my middle son, in November, got hospitalized over Labor Day weekend with a core, which is kind of normal. I know, I have, and that happened to and a kidney infection. He's one that has never had a whatever years. Calling with pulmonology,
Yeah.
and all of a sudden, like, hey, and oh, by the way, I'm leaving here, so.
Yeah.
Let's go. Can you
Let's go
now?
Does your daughter have to come back to audiology?
Yeah, you can do one more right before we leave, because she had tubes. She failed hearing, got tubes, we did this test for the first post tubes. And then it was the 9 months, like, so I was like, hey, let's do it right before we move to, right now it's gonna be San Diego.
Wow.
I'm in the Navy.
Yeah.
So
That's-
the Navy
well,
gets to.
Yeah.
With other. Janetta, I should have just let you do this kind of this. November. I've been working for the last.
Like electrophysics class, where it's like, especially the myelination, and then you're like, I just like, here to show me, I'm like, my professor, raw of vaccine.
Literally spelled nothing.
That's why it's like, it's a lot of material dense, but you're not trying that. Everyone's back.
Oh, no.
Okay, so I am going to draw you guys back up here, if we can. We'll start focusing on this next portion. So as you guys can see here, this is just an example of some prenatal drug exposures, not all by any means, but a lot of the common ones that we come across. And we'll talk about a couple of these in more details with these upcoming slides. You can see within here, there's a wide variety of symptoms. A lot of them overlap. And there are times where you honestly have no clue if mom was exposed to any of these drugs, used any of these drugs. And so this is what can be difficult to parse out with some of these kids, because even some of these behaviors can overlap with anxiety, depression, ADHD. So there's a lot of kind of similarities between, but also differences that stand out. So within the opioid exposure, this is one that had been making a lot more, I guess, like news within the last couple of years, maybe has fallen off a little bit within the last 3 to 5 years or so. But it's one of those, there's not a clear teratogenic effect. So it's not clear, this is exactly what's changing because of the opioids, but we know that it does cross freely between the placenta and the baby. So it can flow freely between, and it is affecting it in some way. Within use for mother, we do see that there's abnormal growth. We see that there are changes within those neurotransmitters and the receptors. The more common thing you hear of are these withdrawal symptoms after birth. So you have the babies who are born to mothers who had opioids during pregnancy, and they may have prolonged NICU stays just due to that withdrawal symptom and trying to manage that. And then within childhood, this is where you can have more of those ADHD related symptoms. So they're very externalizing, very impulsive. Right now, they're still trying to figure out how is this going to affect cognitive. So can there be an effect to it? Yes. How, maybe, what extent, we're not really sure. And then again, there's a lot of just confounding factors with this because there are so many overlapping areas between socioeconomic, nutrition, the parenting themselves, adverse childhood events, so the ACEs. And this is from the CDC Vanderbilt kind of recent policy, but you're seeing overall, the nice thing is that we're seeing a leveling off. So not a decrease, which would be ideal, but at least we're kind of hopefully seeing this plateau where maybe not as many babies are going to be exposed. But you see here between 2004 and 2016, those rates of the neonatal abstinence symptoms of those babies that had withdrawal symptoms at birth grew by more than 5 times. So there was a significant rise in the number of infants affected during that time. And now we're finally seeing that plateau. So with this neonatal abstinence syndrome, it's called NAS or NOWS. That is a baby who's born to a mother with an opioid use disorder, has been exposed to opioids. The withdrawal symptoms can appear anytime within hours to days after birth. So it's not one of those, hey, they reached the 12-hour mark, the 24-hour mark, they're great. This can be one that it can take a couple of days before they really start to show some of those symptoms. One of the classic things you'll hear is this high-pitched cry. We have an example on the next slide. They'll have sleep problems, they'll have muscle problems, some increased tone. He'll have trouble feeding, they'll process the food quickly, have looser stools, more stools, sweating. And then in more severe cases, you can have those seizures and the breathing changes as well. We can do this. And then we can.
You are hungry. So it's time for me to eat.
That's what I did.
It's been a long road for Melinda Markham and her young son, DeMichael. She started taking opioids in 2012 after her daughter was diagnosed with cancer. The pain pills progressed to heroin. Eventually, Melinda stopped, but then started again after the death of her daughter at the age of 5.
It was like the worst it had ever been. I didn't realize I was pregnant until March. So from December until March, I was using.
Melinda eventually went into detox, where she was given buprenorphine, an opioid medication used to treat opioid addiction. In June, homeless, she showed up at First Step Home in Cincinnati, a residential treatment center where women live with their children as they recover from substance abuse.
Reality hits, and you know that you're the reason that's happening.
The opioid epidemic doesn't just touch adults. DeMichael was born in withdrawal and spent a month in newborn intensive care. His withdrawal symptoms were strong, and he eventually went home on a prescription to ease the muscle tightness, jitteriness, and inability to be comforted. Today, DeMichael is a patient at the Neonatal Abstinence Syndrome, or NAS, follow-up clinic at Cincinnati Children's.
There's that smile I've been waiting for.
Gail Hertenstein is DeMichael's nurse practitioner at the clinic.
Melinda keeps all of her appointments. We keep close tabs on him. He is meeting his developmental milestones, and he's doing great. He's doing great.
The NAS clinic provides developmental screening, occupational and physical therapy, and education about nutrition and feeding. As the babies become toddlers, they are evaluated for language and communication, behavioral issues, and overall development.
The long-term implications for, opiate exposure are still unknown. This clinic, to my knowledge, is one of the few nationwide that we have.
Everybody's talking about the heroin epidemic, but everybody's talking about the addicts. It was talking about the overdoses. And where were the children left in all of this? And if we don't address the children, then this is just going to go on.
Unfortunately, business is booming. In 2016, about 4% of babies were exposed to opioids in utero. When a baby needs treatment for withdrawal, the average length of stay in newborn intensive care is 16 to 18 days, and nationally, the average cost is $66,000.
Parental addiction is a very disruptive situation, and the child should not have to suffer because of that.
Each year, as many as 12,000 babies in the United States are born with fetal alcohol syndrome, and the results are devastating. Whether the same will be true for those babies born with NAS is something the clinic will be studying. In the meantime, the clinic is doing its best to get families help as early as possible.
Today is the 3rd. I had my son on the 3rd. I got clean on the 3rd. I am 8 months clean today. It works. It really does work, and it's such a better way of living.
So we do have our videos. So there is a method that has been coming out to try to help treat these babies that really involve the parents more too. And this is something I was heavily involved in as a resident, which is why it's near and dear to my heart. It's one of those where you don't want to necessarily punish families. You don't know their circumstances. You don't know what's going on, exactly what was explained in that video. So within this eat, sleep, and console method, it's one of those where they're really trying to keep the babies with the parents as much as they can, keep them with the mother, with whomever that caregiver is, and allow the caregiver to try to help the baby work through any of the withdrawal symptom signs that they're having. And then if that's not working, that's when it kind of escalates and goes over to the NICU and then has medications and other things. But there are measures that saying, hey, it's here. We're working, we're doing what we can to help support these individuals, change where we can. But even when a baby is born where they have NOWS or NAS, we can still get the parent involved and still have them be a part of their child care. Not here, we have to take your kid immediately to the NICU. So you have that separation. You can't breastfeed. You can't do a lot when you have that immediate separation. So any questions on kind of opioid aspect? And I only say that because now we're going over to fetal alcohol spectrum disorder. So as you can see from here, a lot of people, when you think alcohol, you think of FAS or that fetal alcohol syndrome. As you can see, that's only one part of this whole umbrella of this fetal alcohol spectrum disorders. This is all generally new when it comes. So the initial description was as early as 1968. It's not really that long ago. The first public health advisory was in 1981. And then as you see, the fetal alcohol syndrome diagnosis itself was in 1973. So that's where that's kind of made more notice versus this umbrella term of the fetal alcohol spectrum disorders, or FASD, was coined in 1996. So kind of giving you an idea in the grand scheme of things, this is all new, a lot of new research. So when you're looking and thinking of individuals that would fall under that umbrella, only 20% have the physical and neurodevelopmental features that would be required for kind of that fetal alcohol syndrome and that medical diagnosis. And we do have some pictures in the coming slides to help look at what the features are that we look for that. If they don't meet the full syndrome, you can have this partial FAS, so PFAS. And then again, with some of these, you can have the alcohol-related neurodevelopmental disorders. So that's where they have some of those CNS effects, some of those brain issues, some of the behavioral issues, but you don't necessarily have the facial or the growth issues from there. And then you can have the birth defects, where just opposite. You have some of those physical anomalies, but maybe not all of those developmental aspects with it. So quick question for you guys. Within the US, how many people, what percentage of people do you think have said that they've had alcohol at any point in their life?
Like 1 in 3 at least, I would say.
You said how much?
At least 1 in 3, I would guess.
At least 1 in 3. Anybody else?
I know sometimes, yeah, 80%.
Very high. So yes. And you're remembering, you don't know how much this is. This is just them saying that within these surveys, I've had alcohol at any point in my life. It doesn't say within the past month, year, whatever. It's at some point in my life, I have had alcohol. The prenatal alcohol exposure, it's the leading cause of preventable developmental disabilities in the world. So this isn't just a US problem, this is a worldwide problem. But then when you're looking at these prevalence rates within the US, the other thing is if you look at this youth age as well. So for those who are underage and then more than underage, since our drinking age is 21, not 18 like in other countries of the world, over 20% of youth have also said that they have had alcohol at some point in their lives. The other thing with the trends as they continue to monitor them is that difference between male and female alcohol intake has kind of narrowed. So it used to be where it was very heavy men, you saw more men that drank, not as many women, and this number really isn't that different from one another. For those who are more visual, the small one is those who have not had alcohol. So I know not everyone is text. And then there are two major national studies that have been done. And you can see that within pregnancy, both of them were a little bit different ages. The top one was from 18 to 49-year-olds, and the bottom one was 15 to 44-year-olds, really trying to capture those women who are of reproductive age. It said that nearly 14% of those were currently drinking. The bottom one said 9.8. So say anywhere 10 to 14% of women are admitting to drinking. And then the binge drinking is the other concern. So of those that are drinking, 5% reported, somewhere between 4 and 5% reported binge drinking within the past 30 days. So, and then if you look here, you can kind of see where the state breakdown is as well. So this is the binge drinking on the bottom. The top one is just any alcohol use for those women aged 18 to 44. So not saying any one state's worse than another, but you can kind of see from here, the darker one have the higher percentages, the lighter colors have lower. But when you look at these numbers, you also have to remember people have to report this themselves. This is something that is grossly underreported. Because a lot of times, do you drink? No. Or do you drink? Yeah, socially. How often is that? I don't know, once a month, once a week. And it may not give you that full understanding of how much or how frequently some women are drinking or if all. The effect of alcohol on the fetus really depends on timing, the amount, and the frequency. So kind of how we've broken down the other things into the different trimesters. If you look here, you have the first, second, and third trimesters. The CNS, the central nervous system effects can happen no matter what trimester. As we noted from that earlier slide, those changes occur throughout the entire pregnancy. Alcohol exposure earlier on leads to a lot of those kind of morphologic physical changes. Second trimester, you can have an increased risk of spontaneous abortion. And then the third trimester is where you see that growth, because that third trimester is when the baby grows significantly. You have that 0.5 pound per week. Alcohol can decrease how much they're growing. Kind of a couple of examples, because we know it can also look different in different ethnicities, different races. So what we're looking at for diagnosis of fetal alcohol syndrome or FAS, or just looking to see if they have the features, you look at the palpebral fissure length. So kind of hard to do on kids if you're trying to go with them to a ruler and measure and get close, do it the best that you can. This philtrum here is what it's called, the area between your nose and your upper lip. So you're going to have a lot smoother. The next slide is going to show you a kind of gradient scale, so you can really see the difference between the normal ones and those which would qualify for FAS. And then you have that thin upper lip. So the upper lip just isn't as thick as you would expect it to be. So these are actually the card guides that we have that we use as part of the diagnosis. And it's nice because they do have an African-American, they have a Black one, and they have a white one. No, it doesn't cover all races, ethnicities, but it gives you at least a good idea, and you can kind of compare skin tones as well, because it can be a little bit more subtle for some over others. But you can see the top two for both of those are the numbers that would qualify for FAS. So 4 and 5 versus 1, 2, and 3, which are all those kind of gradients of normal. So hopefully that makes it a little bit more apparent than that prior slide. So within alcohol, we know that it affects the structure of the brain, those neurotransmitters themselves, the receptors, and then the chemical signals that are being sent across the neurotransmitters. So going back to how we started this lecture, and in that first part, you have the decreased neurogenesis, so the decreased formation of the cells. You have the different growth and differentiation of the cells. The migration is different. The synapses themselves are different. And then you have increased death of the cells of the brain. So separate. Sorry, it was stuff underneath and I thought I had the animation, but it didn't go from here. But you can kind of see here where you have that normal brain of a baby at 6 weeks old, and you have the brain of a baby of the same age who was diagnosed with fetal alcohol syndrome from there. So a lot of what you can kind of think with the exposure, the timing, and how it's going is if the mom is a heavy drinker, a chronic drinker, it's going to constantly be in the amniotic fluid. So that baby, instead of bathing in nice, clean amniotic fluid, is sitting there in fluid that has constant alcohol exposure. The other thing is the babies themselves don't have that enzyme that's needed in the liver to be able to process that alcohol. So any alcohol that's in there has to go filter back through the mom to then be able to be filtered out and cleared. The baby can't sit here and take in the amniotic fluid, process the alcohol, and pass it on. It has to be done kind of through the mother as well. So that's where if you have binge drinking and where that binge drinking comes into play, it takes a lot longer to clear that out versus somebody that maybe had 1 drink or 2 drinks. So that being said, there is no known safe amount of alcohol in pregnancy.
It's on.
Oh, it's on.
I'm fascinated like listening to this. So I had my first child in 1995 and my doctors said you can have a glass of wine every night with dinner, but not 6 on a Saturday night. And I mean, that was just par for the course. And I had another child in 97, 98, 99. And that was, is this just like when you know better that you are, is this new information? Or I felt like I was given like go home and relax and have a glass of wine when I was stressed out. That's what they would tell me to do.
We're learning a lot more with
so-
it. So I think this is a kind of growth with time and then the expansion of that knowledge to everybody.
And specifically towards the end of the pregnancy. So when I'm watching that, like the development really affects to that, that's really when they were telling me just go, that was it. Just go have a glass of wine or something. It's just bizarre because it was not that long ago.
And that's, well, and this is a great lead into here. Because if you look at it, a lot of children who have that exposure and why we have this whole now umbrella term of everything is we are learning and finding that there are a lot of these developmental defects and a lot of developmental. So you can have normal IQ, but you might have that low, average, or borderline, and so have lost IQ based on where they would have maybe been otherwise. You can have the attention problems, you can have the slow processing speed, memory difficulties, a lot of things that overlap with ADHD. So there are kids that, if you look at it, may actually qualify for that FASD and fit under the umbrella, but have already been diagnosed with ADHD and they're receiving services and supports from there. Are we saying the maternal alcohol intake is what caused all of these symptoms? No. So it's one of those, we never want to blame moms. We don't want to say, hey, this is because you had that glass of wine at week whatever. But with studies, we're learning.
They were saying it.
And they were saying it.
You know, I did not, but I also, sorry, would drink like the non-alcoholic beer. And I remember one time having like a couple and there is a low percentage of alcohol, even in NA beer, that I was after not having anything, you know, you could feel it. So, but I'm just saying like it was not, don't do it. It was like in general, don't, but they were giving you guidelines to say it's okay.
It's okay to have this amount, but
It's
now as we're
55.
studying and more.
Okay. All right.
And that's why I put those dates earlier in the slide too, because it's one of those where this is really new when we've come with even just coming up with the terminology and coming up with the symptomology of FAS, let alone FASD, which was only in 1996.
Right.
So that's fitting right there with that timeline of what you were saying, even with your pregnancy. So if this umbrella term being coined in 96, that's when we're starting to see that shift of, oh, you can go have a glass of wine at night and it's okay. Yes.
Don't have 6 on it. I'm like, wow. All right.
So, but it is. And that's something that I think people don't realize. It really is within our lifetime and right here within the room where you've seen that shift and you've seen that educational change. And so then kind of breaking it down a little bit more, in infancy, those babies who have been exposed to alcohol have more overstimulation. They may have more difficulty with feeding. So that kind of coordination of sucking and swallowing. There may be some motor milestone delays. And then these babies, similar to the now's babies, may have just a harder time being calmed or being soothed. When you're getting into that toddlerhood, preschool age, so kind of 3 to 5, you have more of the impulsivity, hyperactivity, tantrums. And that's when you might see more of these developmental delays kind of start to appear and make themselves more apparent. Within the school years, they may seem more naive, more easily influenced by peers. So, hey, we're all going to go do this. You're going to come with us? Let's go. There may be more of those memory problems and the retrieval problems. So especially as you're getting into that second, third grade kind of thing where it's like, hey, it's not enough just to memorize stuff. You're trying to process things, go through, retrieve those basics. And then again, you can have delayed physical, so motor, academic, or social development. It can be in any aspect. And then the social behaviors as well. So maybe having a harder time reading social cues of others, thinking kind of what you might see in autistic kids. So overlaps a lot with a lot of different things. So it's hard to even parse out with a lot of these, hey, this is specifically because of X or Y or Z. And then I would skip this down. Oh, here. Yep.
So if a mom had an unintended pregnancy or like gets pregnant and she was drinking a lot previous to the like knowing that she was pregnant, is there anything that she could do to like help with that? Or is it like, yeah, there's going to be problems?
There's not necessarily going to be problems, but the chance of there being problems is higher. It's one of those though, where with mothers, it's never too late to say, hey, how can we help you improve your behaviors, improve what you're doing? If you go from drinking 5 glasses down to 1, hey, that's still an improvement. You know, is it ideal? No, but even just looking there. So, hey, what's past is past. We can't change that. We can't fix that. The big thing is, what can we do going forward? And trying to maintain that mentality, because there is a stigma, both with this and with opioids, with any drug use from there, where it's, well, why did you do that? What were you doing? I was told by my providers it was okay. And I mean, if you have providers that aren't keeping up to date on some of the stuff, this is how things easily get missed, especially when it's first announced and kind of first made aware. And again, that's where you have that stigma hiding maybe how frequently it actually is, or women downplaying how much they are actually drinking or how often they're binge drinking from that standpoint.
And to start binge drinking, like 3 drinks, right?
It's really not much at all.
Like binge drinking is not much.
It's really not much for women. It is different between males and females, and the amount for binge drinking and qualifying for alcoholism kind of overall is much lower than for females. And that's just because of how our body processes it.
This is kind of off topic, but some of those restrictions that I've heard before too are like deli meat and tuna and certain things that women can eat too. Have those changed at all with research or?
So a lot of those are still kind of the same. I don't know at what point that is, but that's more similar to kind of Zika and bacterial exposure. So we know that deli meat, if it's improperly handled, is more likely to potentially contain bacteria that can then affect the fetus from there. So I don't have, you know, what time frame those were added, but that's why those are still, hey, don't do this. Because the thing is, if you know, I had this from the processing, it's never left a refrigerator, it's never done anything, it's fine, then that's one thing, versus especially with our and I guess how everything is now, where we've had a lot of shipping issues, we've had a lot of issues. It's like, oh yeah, this is fine, it's been fine the whole time. And it's like, well, has it? Or was there a point where maybe the refrigeration wasn't as cold as it was supposed to be, but nobody realized it? And so that's where that risk comes from, because you really don't know, if you don't prepare it yourself, what may have been exposed.
And we're going to talk a little bit more about the fish here. It's a good segue.
It is. And that's where it's like going to the chemicals right now.
Yeah. Good transition into the next section. Yeah. So industrial chemicals are another big exposure risk for the developing fetus and brain development. So with industrial chemicals, there are 5 that are known to be toxic to the developing brain. So can anyone throw one out there? Lead, that's one. Mercury, that's a fish. We'll get to that. Yeah.
Saturn.
What'd you say?
Saturn.
No. Oh, you're thinking planets. Yeah. So lead, mercury, arsenic, the PCBs, and then toluene, which is an industrial solvent. So those are the 5. But there are of other industrial chemicals, 200 are known to be toxic in general to humans, not necessarily to development. And then over 1,000 in experiments have been shown to be toxic, but look at this chemical universe of greater than 80,000 that we just don't necessarily know. So these are just some headlines about, probably you may have seen some headlines in the past about arsenic in rice and in cereal. And a lot of that is because some of the rice patties, well, arsenic is a natural element in the Earth's crust. So some of it is naturally in the soil, but then also it's used in industry, and some rice patties are on top of like old industrial sites and things like that. And arsenic is still there. This is the fish. So you can find this if you're interested in more detail. And I know you can't really see it from here, but there's basically recommendations on avoiding. These are the best choices of fish to choose. And there's kind of good choices. And then this orange area is fish that should be avoided if you're pregnant or, and also for young children.
A lot of ways to think for fish are those higher on the food chain that eat more. The more they eat of the other fish, the higher they are the potential exposures.
Because the little fish get the absorption from, it's from industry that they get the pollution and stuff. They get to absorb it. The big fish eat the little fish, and it kind of, concentrates basically. And unfortunately, homemade is not necessarily better than what you can buy in the jar, and it's because it's in the food supply. So what you're using to make the homemade also may be contaminated. So just something to be aware of. So again, just kind of back to this, and what the problem here, of course, is the unknown. We don't know what we don't know, and that's a big issue. And we need more research in this area, more advocacy in this area. We'll talk about that a little bit more. But those windows of vulnerability include, for adults, just a decreased lifespan. When you talk about people that are exposed to pollution, arsenic, mercury from coal, for example, or asbestos, chronic diseases. Some of these have been related to cancer, heart disease, lung problems, and then developmental difficulties with IQ being less than it would have been, learning disabilities, ADHD. So what I want to talk about is it's not an accident that people of color are higher exposed to a lot of these industrial waste and pollution. And it's a big issue through redlining, discrimination, racism. So environmental racism is basically how those policies were put into place, and that there's a much higher rate of being exposed to landfills, power plants, mines, just increased particulate matter in the air through pollution. And let's see. This is kind of a definition here.
In America, air and water are separate but unequal. Environmental racism is the new Jim Crow. Yeah, I get it. The environment isn't a person. How can it be racist? But the most basic pieces of the environment, the air we breathe and the water we drink, are controlled and designed by people. And people can be racist. More than half of all people who live close to hazardous waste are people of color. Floodplains nationwide have high populations of Blacks and Hispanics. Black children are twice as likely to suffer from lead poisoning as white children. This inequality is no accident. Pollution and the risk of disaster are assigned to Black and brown communities through generations of discrimination and political neglect. Enslaved Africans were commodities partly because their work carried environmental risks that were unacceptable to whites, like exposure to heat, malaria, and mosquitoes. As Jim Crow laws created racial segregation, they also reinforced an environmental system that still disadvantages minorities. It's no wonder that Black and Hispanic children have the highest rates of asthma, or that hurricanes like Katrina, Sandy, and Matthew did their worst damage in communities of color. Rich white neighborhoods can update their water pipes, but not places like Flint. The Jim Crow laws are dead and gone, but the fact that people of color are still more likely to die from environmental causes is no accident. In America.
Okay, so just another headline about pollution being related to, preterm birth, and we talked about that and the risks associated with that. So communities that are exposed to more pollution, again, have higher risk. And unfortunately, just this year, Supreme Court rolled back some of the EPA's power to regulate water and air pollution. So this is like a big policy issue, big advocacy issue in our country. I think we have time because I do like some of these kind of real, kind of lived experience stories. So bear with me.
Plaquemines Parish is an incredible place. You can tell that the communities that are there have been there for a long time. You can also tell that the industry that's been there has had a huge impact on these communities and the way they live their daily lives. I've never seen a place in the United States where you can so clearly see the intersection of pollution, environmental injustice, and climate change. So last summer, I joined Senator Cory Booker, the U.S. Human Rights Network, and 350.org on a trip to the Deep South to meet people in some of these affected communities.
This is a civil rights issue. Please understand, this is a civil rights issue.
At the Greater Morning Star Church, we heard from parish residents, including Lyric Turner, one of the young members of the Zion Travelers Cooperative Center. Lyric had recently taken a flyover of the parish to see the land lost for herself.
I plan on coming back, probably 30 years from now, having my kids come see their grandmother, their grandfather, their auntie, their uncle, wherever it is, coming back down here. But if nothing is done for us, they can't come back to anything.
The communities I visited in Plaquemines Parish that were dealing with heavy industry and sea level rise the most were Black or brown. And really, that's no coincidence. It's not uncommon for Black and brown communities to be targeted for industry, landfills, coal mines, pipelines, you name it. This is happening all across the country, not just in Louisiana. Of the 9 million people living near a hazardous waste site, 56% are people of color. And Black Americans are 3 times as likely to die from air pollution. These stats are evidence of what the larger movement would call environmental injustice or environmental racism. It's no accident that these communities have industry in their backyard. This is the outcome of decades of public policy and decisions made by people in power. Between Baton Rouge and New Orleans along the Mississippi River lie some of the highest concentrations of industrial plants in the country. The impact of these industries on the surrounding communities are the reason this part of Louisiana is called Cancer Alley. In St. James Parish, residents have watched their once thriving community transform into an industrial zone. Over the years, 15 large-scale industrial plants have moved into the area. Residents say it's because of the impact of these industries that there's such a high rate of cancer in the region.
I'm a resident here in Chapman Town, going on 64 years. I worked in industry for 25 years. I've lived around here 64 years and saw everything to change. 3 months ago, I was diagnosed with breast cancer.
This community has been facing industry in their area for generations, but they're fighting back. Pastor Harry Joseph, the man who runs the church that we visited in St. James, has already filed a lawsuit against companies planning more pipelines and more industry in the area.
I declare that if God is pleased, He's going to take us to do it. And we got to fight for what God has given us, and that's our lives.
Another stop we made on our tour of the Deep South was in Africatown, a small community in Plateau, Alabama. You might have heard of Africatown. It's the home of the last known slave ship to dock in America, nearly 50 years after slavery was abolished. Africatown and Plateau were also the home to the International Paper Company in the 40s and 50s, which provided family-sustaining jobs to all of the communities that lived in the area. For years, the paper company pumped pollution into the air and water of this community, and now we're seeing the long-lasting effect of that pollution on the families that are still there in Africatown.
I have lived in this area most of my life. It was 7 siblings. In my family, there was never a history of cancer, respiratory problems. However, 5 of my siblings have died. And of the 5 that died, 4 of them died with cancer. There are 2 surviving, my brother and myself. I am a twice survivor of cancer. It should not be where parents bury children. Children bury parents.
Residents of Africatown have already filed a lawsuit against the International Paper Company. The paper company says they didn't do anything wrong, but community members and community leaders like Major Joe Womack say that something has to be done to hold this company accountable. People in cities like Africatown, St. James, Plaquemines Parish, they're up against a whole lot more than industry.
They live in conservative states. They have representatives that don't care about them. Oftentimes they're poor or they live in rural areas. But they're still organized. They're fighting every day. They're filing lawsuits. They're showing up to meetings. They're door knocking. And they're voting for people who they feel will make their communities more resilient. Environmental justice has turned into a big talking point in the climate community. But when it comes to funding organizations working on the issue, they are often overlooked and these communities are sometimes underserved. In a broader sense, organizations working to curb global warming forget to include environmental justice in their policy proposals or their larger campaign initiatives. But in reality, focusing on environmental justice could be how we right some of the wrongs done to Black and brown communities and stop the climate crisis.
Okay, so what are some of the effects of some of these like industrial things that are leached out into the environment by some of these big companies? And lead is one of the most well-known, well-studied ones, was banned in Europe a long time ago, but not in the United States until 1978 in paint, and in gas not to the 1990s. It is ingested more easily in children, which is why they tend to have a higher problem with it, that more effect, because they absorb 50% of the lead that they ingest versus an adult who would only absorb 10% of any ingested. And then we know that there's can be changes in the structure of the brain as well as the function from absorbing lead with a estimated IQ deficit or decline of about 4 to 5 points for every 10 milligrams of lead. So ADHD is another common sequela as well. And here you can see the white throughout the intestinal system here down in the colon, and even up higher are little lead chips that you can see where a child has ingested a bunch of lead paint chips. And as one of the videos referenced, Flint is an area where the well-known story about a lot of kids getting lead poisoning because they tried to save some money by moving the water, and some of those old pipes leached lead into the water system. In Ohio, we have our own kind of program for trying to mitigate some of that, remedy some of that. And we have a clinic here at Cincinnati Children's, a lead clinic as well, to see and treat children who've been exposed. Mercury is another one. It's often inhaled by the exhaust from, again, pollution, coal mines, pull off a bunch of this into the air, put it out. It's not as well studied as lead, but it's felt to be similar in the mechanism of creating damage. The ethyl mercury, which is thimerosal, is not thought to be toxic versus methyl mercury. But again, here the problem is that we don't know, we don't know what we don't know, and a lot of these things haven't been studied. And why is that? Well, the U.S. Toxic Substance Control Act in 1976, it does regulate that chemicals need to be new chemicals that are coming out, that companies have to report any problems that they know about with them. However, it doesn't require any pre-market testing of any new chemicals, and doesn't require ongoing surveillance of things that are, and nothing for pre-existing chemicals. So it's a big issue. And Europe and Canada have much stronger laws that are enforced to help protect their population than the US does. So we're going to power through here just to get this last part done. This is the shortest part. And, development does not stop, once a baby's born, and there's a lot of brain development that continues in the first few years of life, in particular that neuroplasticity. So the ability of the brain to kind of make new circuits and to reinforce those circuits, learn new things, is really highest in these first few years, very important as we're getting kids ready for school. And so the objectives for this part are just understanding some of those protective factors that help young children with brain development, and to understand how those experiences can help us get our kids ready to learn, ready for school. And those protective factors include, loving caregivers, a stable, nurturing environment, exposure to other kids through play, structure, routine, opportunities to be independent. Those are all very important for learning. Early brain development and school readiness. It's important to kind of think about some of these pathways as being integrated and cumulative, but non-linear. So it's not a straight line. There are periods of time where children are learning a ton, and those things, those pathways in the brain, those neural pathways are getting reinforced. Those become more stable. And then there's just some normal kind of what we call that pruning back of pathways that aren't needed. And so these are also important periods where those like synapses that we talked about earlier, these are still being formed and kind of managed a little bit, modified a little bit within the brain. But the social environment and the environmental environment do make a huge difference in this brain development the first few years of life. And that repetition that we talk about, really important for strengthening those pathways. So that plasticity can really have some detrimental impact if the child is exposed to something that's been coined as like toxic stress, meaning just a very chaotic environment, a very stressful, challenging environment, can actually cause some structural and functional changes to children's brains, especially in the hippocampus and prefrontal cortex. But there are some things that even in a very kind of stressful environment, chaotic environment, that being in a safe, stable relationship with loving caregivers can mitigate some of that toxic stress. So we never want to underestimate the importance of those loving, nurturing caregivers in any kind of environment. Dr. Pamela High, who was one of the pediatricians on the AAP, Council on Early Childhood, coined this kind of 5 R's of early childhood that makes it a little bit easier to remember some of the important things, including reading together daily. These are things that, families can do. It doesn't have to, and for people that have lower literacy, I mean, just stories, just hearing those kind of stories from families, really important. Rhyming, talking, playing together, those routines around meals, play, and sleep. Rewarding everyday successes, that kind of positive reinforcement, and then those relationships. So the supporting, nurturing, stable relationships that we talked about, very helpful and critical for brain development in those first few years. So one last video, I promise, and then there'll be time for more questions. Maybe. Let's see. There you go.
Imagine a world in which infants are trying to make sense of everything. The sight of a face smiling and a voice talking.
Who's a silly Billy?
All of those senses are awake and alive. To me, that's genius. We all are walking around with brains that got forged early in development. Our brains come ready to learn, but they're not completely formed. The infant brain is coding all the time. They're trying to understand, what are the signals that mean I'm going to be fed? What are the signals that mean I'm going to be loved and touched? The baby's learning that when I give the merest hint of a smile, my parents go gaga.
Viva, look here. Felix.
They're computational geniuses, but this computational genius takes place through the social channel that codes the most frequent things that happen in their world. And built into that is the drive to do the things that we do so they can be like us. We evolved to make the littlest citizens in the world grow into the full potential adults they become. And the way to do that is to supply innate curiosity and to start with a brain and senses and cognition that's ready to go on day one.
Tap, tap. Tap, tap. Tap, tap, sand.
You want me to tap the same as you?
Yeah. Sand.
Get sand on it first? Okay.
Yeah.
Sand. And we tap it?
Yeah.
As adults, we have lost some of the creativity of youth. We are not the baby walking down the street, enamored by the picket fence and the bus, with this wide open mind that the poets used to talk about. We have narrowed our views. We're less enthralled by novelty. In fact, our brains tend to keep us on the narrow, in-the-box thinking. And we can already see the decline in the ability to learn like that at 7. There are many ways that we've tried to understand what it means to be human. You can study cave art. You can look at the heavens. And I think one of the best ways is to look at a baby and understand how that baby comes together. We all developed. We all had a childhood. And it indelibly affected who we are today.
Do I have any Bluey fans in the room, by the way? I was gonna say, what episode does this make you guys think of? Does anybody? Because, well, this is one where this is very big with the born yesterday episode, where dad pretends that he was born yesterday and the girls get to explain everything to him and he gets focused on a leaf. And at the end of the episode, mom's like, are you guys still playing? And they're like, no, we stopped. And all you see is it go out to dad, who's still just staring at the leaf and looking at the veins and looking at everything. So if you want to feel like a child again, go to Disney Plus, go to Bluey, look up Born Yesterday. It'll be great.
Okay, thank you for your attention, everybody. What questions can we answer? And then we'll let you guys have a break before SCBM.
Going back to the physical presentation of fetal alcohol syndrome, I forget what you called the bumps under
The philtrum?
the philtrum. Yeah. So does that like ever eventually grow, or is that like pretty much always gone? Like even as an adult?
It's always going to be flattened, even as an adult. Yeah. I know, we're all touching our philtrums, yeah.
The area of your face, you have no really,
Right.
you haven't thought of that.
Any questions in the chat? I don't know, Maria, were you checking for? Okay, all right, great. Well, thanks so much, everybody.
You know, it's a lot, so.